Okay, so I'm going to share with you guys this information that I have received today from my doctor in regards to ranitidine. Now, I know that not just myself, but a lot of other people have been receiving letters, statements and letters from their pharmacies telling them that there has been a recall from the ranitidine, and it really is true. I have one right here that I received, and also seeing things on the internet that is showing that there's been harmful chemicals in it that has been caused, or that has been proven to be caused or can cause cancer. So it is, it's scary and alarming, especially for us women that have taken it throughout our whole entire pregnancy, because we not only have been taking that in our own bodies, but also, giving it to our babies. So I was concerned, very concerned, and so I wanted to talk to my doctor about it today. So I took my baby into the doctor. She was having a little bit of an ear problem. She was pulling out her ears. So just to make sure she doesn't have an ear infection, I thought I'd take her in and also ask the doctor my question. I told her just what I said to you. I've been seeing this all over the internet. I received a letter from my pharmacy, and what is going on? Like, did I set my baby up for failure in the future by feeding her potentially harmful poisons that, can cause cancer later on down the road? So what she said is that the findings that they have been finding, the reason why it was recalled is because there have been lab mice that have resulted in getting cancer from this medication. Now, she said that there has not been anything that has been proven to give this to humans, that humans have resulted in getting cancer. So far right now, it's just been lab mice. So I told her, there's got to be some kind of grounds as to why there is lawyers, like lawyer groups, reaching out to people and putting it all over the internet for people to come forward if they took it while they were pregnant or just have taken it at all. And she said that basically that the lawyer groups are just wanting to make money. She said it's all about money. And, we went on and on about this for like a good 25-30 minutes because I really wanted to know what was going on, because told her on what grounds do they have then? If there's been no proof that it has given it to humans, then seriously, what is going on? And so for right now, she said that's the only thing. She said that if I have a real concern, and she said that she's not concerned because she said, well, my child has been on it and, they're okay. And she was looking up my baby's records and seeing her growth progression and everything. She's like, well, she's in the 90 percentile. I'm happy with her weight. I'm happy, with her growth and everything, her developmental and just everything is exceeding. And so she said that basically if I'm really concerned, that she could send us to a GI specialist. But she said even if we go to a GI specialist, they're going to ask us, a checklist of things. And based off of, what she has looked in her charts, that they're really not going to want to do extra testing or to go start doing extensive testing on the baby. So, and plus I wouldn't want that either. I wouldn't want extensive testing on her when, there is no signs, thanks to God, and prayerfully never be signs of anything, going on. So, she said now if there were to be, when she uses the bathroom to be, blood clots coming out, or if she were to be vomiting blood, then that would be something of great concern and in needing to be seeing a GI specialist to see what is going on. And she said even there's times that, that you might, she's in the future, if she goes to the bathroom, you might wipe her and see a little line or smear of blood in her stools, not to be concerned about that either. She said, because a lot of times, when they're constipated, that when they're pushing, it can cause a fissure, which is like a little small tear in their little booty, and they can bleed a little bit. So she's like, don't get extremely alarmed if one of these days that does happen. Just giving me a heads up. Now, she said, now if she starts to lose weight rapidly out of nowhere and, refuses to eat for, days on end, and not just like a couple days, because sometimes babies, kind of refuse to eat their normal amount within like a couple days, and it could be to teething or just not feeling well, just the same like with us. But if it were to be an extended period of time, like a week, then that would be alarming, that would be concerning, that would be something to look at, to go into the doctor, and then, to move on forward from there. So, I just had to really put myself at ease, because I've been concerned about this. There's been a lot of different nights that, I have stayed up late at night thinking about and worrying, as I know some of you have as well, because, it's scary to be seeing that, that all these ads coming up and stuff, and letters from the pharmacy stating, that there could be something in this medication that has, that can cause cancer, especially with people that have a history of cancer. In my family, we have a history of colon cancer. And so it was, it was scary to me. And the fact that I was pregnant taking the whole entire time, I was not wanting to be feeding my baby poison the whole entire pregnancy or ever. So, I took this also when I was pregnant with Mila. I didn't take it as much or as often as I did this pregnancy. So, thanks to God, she's doing great. She's fine. The doctor had asked me, well, if there's any problems with the stomach, has she had problems with her stomach at all, like either of them? And yeah, they have. In the beginning, when they were really little, they had, a lot of like it's upset tummies, just the normal, what babies go through. A lot of them, have a rough start. The first 6 to 8 weeks, they get acid reflux and just, a lot of gas and whatnot. But other than that, thanks to God, they are doing great. And so, still a little part of me is just like, I'm just a little bit scared still, a little bit, and just trusting God. I'm just putting my trust in God, and that's what gives me the peace that I need. He gives me the peace that I need, just to know that everything is going to be okay, and that it is okay. But it's just alarming. Like, I'll read to you just a tiny little bit right here from what the pharmacy had sent me, and just so you get an idea, it says to me, it's on December 17, 2019, the United States Food and Drug Administration published a notice regarding a recall of all unexpired lots of ranitidine, 150 and 300 milligram tablets manufactured by Glenmark, and that this recall was issued because an unexpected impurity was found in these products that could be a health hazard or safety risk to patients who may be using the product affected by this recall. And our records show that you may have received this prescription for the following medicine recently through our pharmacy, and that you may have received a text and phone call regarding this notice, which I did. I received a text. I had received different phone calls, them leaving me messages, and also this letter. So I'm just like, my goodness, like, it scared me. The first time I ever heard about this was just reading it on the internet. And then I was just like, is this true? Because, a lot of things are on the internet, and you can't go by what just the internet says. Absolutely not. But then, like, within a couple weeks, I received a letter from my pharmacy. And so I just started to get really scared and alarmed. And so I thought today would be the best time to set the record straight, talk to my doctor and see what they had to say. So what she had to say was mainly like the more concerning thing is that I was taking it. She said that, yeah, when you take it, that some gets into your bloodstream, which crosses over to the placenta. But the majority, you know, if it were to, God forbid, affect anybody, it would be myself, because I was the one taking it, and it was being distributed through my body the more than it was passing through to the baby. So she said, you know, like if I'm having any issues, she said things to look out for anybody is if you are having bloating, if you are feeling like you are really full when you just barely even ate or you didn't even eat at all, if you have like chronic constipation, if you have blood in your stool, things like that, you know, to be vomiting blood, that you need to get in to see your doctor, because you would be needing to see a GI specialist and to, you know, take things further. So I just wanted to share this with you all. I know you guys who clicked on this video, you probably are concerned as well, or maybe just curious because you have kind of seen this floating around, even though you haven't taken the medication, but you want to know like what is going on. So that's what I have found out, and just wanted to share with everybody what I found out to hopefully give you guys a little bit of peace of mind. I would recommend still contacting your doctors, still seeing your doctor, and, you know, seeing what they have to say about it. And I also think that I'm going to probably talk to a pharmacist about it. I'm going to like call my pharmacist and see what's, you know, what their take is on it, because I'm not going to just like settle just for one person, what they have to say. And, you know, I want to, you know, really find out what's going on. And I also think I am going to reach out to one of these 1-800 numbers that I've been seeing online. So, you know, like if you have taken this medication, call us. I think I'm also going to reach out to them too. And, you know, I will gladly share the information that I find out as well. All right, so I hope you guys found this video informational, hopefully a little bit helpful. I'd appreciate a thumbs up. It really does help the algorithm on YouTube to help, you know, get my videos out there, because I'm really trying hard with my videos. I really enjoy, you know, putting stuff out that I learn for you guys to learn as well, and just stuff that I know, tips, tricks. You know, my videos are a little bit of everything. So, you know, it always helps. You know, leaving comments, sharing, anything, you know, helps out, and also subscribing. If you guys are not a part of my YouTube family, I would love to have you guys a part of my YouTube family. Thank you so much, you guys, and you guys have a wonderful day. Stay safe, be safe, and God bless. Bye.